Good afternoon, everyone, and welcome to today's event, Dissemination of Bangladesh Adolescent Health and Wellbeing Survey 2019-20 Findings at Hotel Intercontinental, Dhaka, Bangladesh. Our event is today graced by the kind presence of Mr. Mohammad Zahid Malik MP, Honorable Minister for the Ministry of Health and Family Welfare, Government of the People's Republic of Bangladesh as chief guest. We have among us Professor Nasima Sultana, Additional Director General Health, and Ms. Shahanara Banu, Director General Family Planning. We are also happy to have Mr. Tahmid Ahmed, Executive Director, icddr, and Mr. Zersis Sidwa, Director, Office of Population, Health, Nutrition and Education of USAID Bangladesh, as special guests. Today's event is chaired by Mr. Sushanta Kumar Saha, Director General, National Institute of Population Research and Training, Ministry of Health and Family Welfare. Ladies and gentlemen, as you can see, our event today is happening both in person and virtually. And it is indeed our honor and privilege to have you all who are here or are joining us remotely in this very important event. Before commencing the program, we'll hear a recitation from the Holy Quran by Muhammad Mizanur Rahman from NIPORT.
Assalamu alaikum wa rahmatullahi wa barakatuh. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وليستفد الذين لا يجدون لكاها حتى يغنيهم الله من فضله والذين يبتغون الكتاب مما ملكت أيمانكم فكاتبوهم إن علمتم فيهم خيرا صدق الله العلي العظيم وصدق رسوله النبي الكريم السلام عليكم ورحمة الله وبركاته ومغفرته.
Thank you, Mr. Mohammad Mizanur Rahman. Ladies and gentlemen, I would now request our chief guest, Mr. Zahid Malik MP, Honorable Minister of Health and Family Welfare, to formally unveil the Bangladesh Adolescent Health and Wellbeing Report. And I request Mr. Sushanta Kumar Saha, DG NIPORT, to hand over the report to the Minister. Thank you, everyone. Now let's hear from the Honorable Minister. It is my absolute honor to invite Mr. Zahid Malik MP to share some of his insights on today's topic. But before that, let's get some welcome remarks from Mr. Muhammad Rafiqul Islam Sharkar, Director Research from NIPORT.
Bismillahirrahmanirrahim. Distinguished Chief Guest, Mr. Mohammad Zahid Malik, MP, Honorable Minister, Ministry of Health and Family Welfare. Our special guest, Mr. Tahmid, Executive Director, ICDDRB, Ms. Sahanara Banu, NDC, DGSP, Ms. Nasima Sultana, ADG, Health Services, Mr. Zarjes Sidwa, Director, Office of Population, Health, Nutrition, and Education, USAID Dhaka. Respected Chairperson, Mr. Sushant Kumar Saha, Director General, NIPORT. Representatives of development partners, renowned academicians, researchers, fellow colleagues, and participants, representatives from media, ladies and gentlemen, Assalamu alaikum and good afternoon. At first, on the Mujib Barsho and on the eve of 21 February, my regard, respect, and tribute to the great father of the nation, Bangabandhu Sheikh Mujibur Rahman, my homage and tribute to the Shaheeds who sacrificed their life for language movement, also my homage, respect, tribute, and honor to the freedom fighters who sacrificed their life in 1971 for giving us this beautiful country, Bangladesh. Ladies and gentlemen, it is our great pleasure to welcome you all to this dissemination seminar of Bangladesh Adolescent Health and Wellbeing Survey 2019-20. Similar to the work of series of Bangladesh Demographic and Health Surveys, utilization of essential service delivery surveys, Bangladesh maternal mortality surveys, Bangladesh health facility surveys, NIPORT has undertaken this Bangladesh Adolescent Health and Wellbeing Survey activities under the Training, Research and Development Operational Plan of 4th Health, Population and Nutrition Sector Program. It is the first of its kind. Ladies and gentlemen, adolescence is the period when the individual has to deal with significant physical, mental, and emotional changes as they begin to transit from childhood to adulthood. 1/5 of Bangladesh's total population consists of adolescents, and it is expected to grow in the coming years. Given the vulnerability of this life stage, Sustainable Development Goals, Bangladesh Adolescent Health Strategy 2017-2030, and 4th HPNSP 2017-2023, it is important to ensure that adolescents are given the necessary services, information skills, and opportunities to develop their full potential to become productive and remain in good health. This survey was designed to examine and understand the state of health and well-being of male and female adolescents ages 15 to 19 years. Carrying out this survey is a big job, much bigger than any organization can do it own. We have been very lucky that so many groups and so many dedicated people here in Bangladesh and from abroad have worked together to plan, design, and implement this survey, ICDRB, measure evaluation, data for impact, University of North Carolina, USA, and USAID Bangladesh provided technical assistance for successful completion of this survey. Human Development and Research Center, a private research agency, was responsible for data collection, data entry, data processing. We are indebted to all of them. Ladies and gentlemen, today we are happy to have all the experts of these organizations with us, physically and virtually. But the results of this survey are going to present by a group of adolescents. You will learn about it from the next presenter as well as the adolescent presenters themselves. This wonderful opportunity will help to see where the adolescents are and where they had to go. I hope it will be excellent presentations. Presentations will follow my opening remarks. The young adolescents will bring presentations to us with their introduction. Ladies and gentlemen, the Bangladesh Adolescent Health and Wellbeing Survey was guided by the members of the Stakeholder Advisory Committee, which consisted of experts from government, non-government, and international organizations, as well as academicians, researchers, and professionals working in the health, nutrition, and population sectors in Bangladesh. A technical working group with representatives from NIPORT, Ministry of Health and Family Welfare, PMMU, University of Dhaka, icddr, USAID Bangladesh, and measure evaluation and data for impact assisted in designing the survey instruments and implementing the survey. I would like to put on record our sincere appreciation to the Stakeholder Advisory Committee and Technical Working Group members for their effort in all stages of the survey. I would like to express my special gratitude to our Honorable Chief Guest for his kind presence in this seminar. A special thanks to the respected special guests for their kind presence in this event. I would also like to thank Mr. Sushanto Kumar Saha, Director General NIPORT, for his valuable guidance and direction at every stage of the survey's implementation. Finally, the Government of the People's Republic of Bangladesh, USAID and FCDO deserve a special thanks for providing financial support for this survey. Ladies and gentlemen, now we are going for presentations. I would like to call upon our first presenter, Mr. Afsanul Alam, the evaluation specialist of NIPORT, to introduce the survey with short highlights on specific objectives, survey design, sampling, field implementation, etc. Thank you so much. Allah Hafiz.
Thank you.